Hello, noswaith da. Murdoch Jones ydw I o Ddimbych. I'm Murdoch Jones and I'm here also representing SOG, Save Our Green Spaces. TCC member groups have told us that mental health services are overstretched. If elected, what practical steps would you take to improve access to timely, community-based mental health support across North East Wales?
Diolch yn fawr, Mike, much appreciated. Can we start with Carolyn, please? Sorry about that.
Okay. Wales became the first nation in the UK to roll out 11 Press 2 for urgent mental health support. We know there's more to do, and one of our key pledges is to transfer mental health to easy-to-access same-day services so that everyone can get the right support where they need it, with a particular focus on community-based mental health support for mums and new mums. There are more training places available at Wrexham University now for mental health nurses. I know my niece changed from being a school admin to mental health nurse, and within 4 years she's just been headhunted for a band 6 job leading a team, which is amazing. We need to tackle mental health early on, build strong communities and advertise activities locally. Loneliness is so debilitating and painful. We need to create places of belonging. I've been working with Prostate Cancer North Wales and introduced a couple of men to that group to give them that support, because it's mental health as well as cancer support that they need. We have Andy's Man Club in Deeside, which is a free talking group for men over 18. I checked their Facebook page this evening. They had 3 new men attend this week. So that was 27 attending this week. Before I finished as a Senate member, I met with the men's sheds, and they do great work, and they've expanded to also youth sheds as well in Abergele. Access to nature is so important. Welsh Government has developed the Local Places for Nature Fund, which, as well as protecting biodiversity and ecology officers, it's created areas for biodiversity, therapeutic gardens, community orchards and allotments with 200,000 volunteers across Wales, which is great for the physical and mental health and well-being. Flintshire and Denbighshire Council work with volunteers and people struggling with their mental health as well. I chatted to somebody at Wepper Park recently. And places like the Willow Collective in Denbighshire is really good. Public transport is so important for investment. I've got repair cafes across Wales.
Llyr Gruffydd, Plaid Cymru.
Thank you all. I'm particularly passionate about mental health services because I've spoken openly about my mental health problems in the past, both in the Senedd, in a number of debates, but also in public fora and other spaces as well. Now, in a period where public services are under pressure, Plaid Cymru is committing in our manifesto to ring-fence and protect mental health budgets. We're also proposing to create a new role within the Cabinet, which would be a new Public Health Minister for Wales, who would have a responsibility for well-being across everything that the Welsh Government does, physical and mental health. We've already played our part in securing new mental health crisis hubs for young people, something that we want to replicate across Wales, where young people can literally drop in and the service is there available for them when they need it. We believe that the public and third sectors there's an opportunity there for them to work better together, I think, more seamlessly, because the third sector is a big part of the work that needs to happen here. We want to promote a no wrong door model as well. When people access services, that they can easily be referred to mental health services, no matter where they interact with public service providers. And we want closer integration between CAMS, children and adolescent mental health services, and adult mental health, because there is a cliff edge for young people, transitioning or transferring into adult mental health care. So there are other things as well, but I'm conscious of time. But I too have played my, part in supporting a number of mental health efforts and organisations in the Clwyd constituency, including Denby Men's Shed, of course, which has been under siege from a number of directions in terms of where they're going to be located in the longer term, etc. And that, I hope, will continue. Thank you.
Diolch yn fawr iawn. Thank you. Louise, Emery, Reform.
I think we're all going to be in agreement on this table tonight about mental health across Wales. It is an absolute emergency, and it's affecting particularly young people. Like, that's just tragic. I have teenage daughters, and it is tragic to see in their friend circle people really suffering and not having that resilience and that support behind them to get through the rough and tumbles of life, and then that leads into a mental health decline, particularly isolating themselves. It's really sad to see, and I've had personal experience of that. I think when you actually, the third sector do such a fantastic job. I mean, 10, 15 years ago, we didn't have men's sheds, women's sheds, kids' sheds. The third sector have filled in that gap that the statutory services have no longer been able to fill, and that's fantastic. But ultimately, I think that we have to, particularly around here, sort out Betsy Cadwallader Health Board, because when you actually need proper mental health support that goes beyond the third sector, you need proper intervention, medical intervention, then we know that's not going to be same day. It'd be fantastic if it was. So I think we have 20 points in our manifesto about the NHS. I'm not going to read them all out here. They're online. NHS is absolutely vital for the health of this country and for the health of the people of Wales, and we are hopefully going to sort it out. But I won't be the first politician that said that, and probably won't be the last. Thank you.
Diolch yn fawr iawn, thank you.
Right. Well,
yeah, Gareth.
You ready?
Gareth Williams. I was trying to use my phone, Gareth, there for the timer. So, yeah, Gareth Williams, Conservative. Okay.
I'll briefly hark back to the point I made in the first question about funds to help communities hang on to their vital public spaces, libraries, parks, pubs. The soft benefit of these areas of being able to engage with the community in places to meet and stay in touch with people. The soft benefit of that is not to be underestimated regarding mental health. On a more solid note, we would pledge to increase spending on mental health and wellbeing services in real time each and every year. Part of this increase in spending would go towards the establishment of a network of mental health crisis centres across Wales, which would be open 24/7 to provide timely access to care and support. We would look to treat mental health with the same urgency as physical health, and as part of that we would start to publish mental health waiting times and other performance data to stop problems building up under the radar and to allow us to realise where funding and support is needed faster and on a more focused basis. We'd look to improve access to talking therapies in a bid to end over-reliance on prescribed drugs to treat symptoms of poor mental health. And we'd look to increase funding, particularly for veterans NHS Wales, knowing that military veterans require quite specific needs, peer mentors, support and treatment.
30 seconds.
And then the final thing, which would be worth mentioning, is the establishment of a dedicated mother and baby unit in North Wales for those with severe postnatal and mental health challenges.
Diolch yn fawr iawn, thank you. Can we have Carley, please, from the Green Party? Thank you.
Is that right? Thank you. So again, this is one of those issues that's so intertwined with everything else, and I think you need to look at having a holistic approach to mental health. So from a Green Party perspective, we're really wanting to focus on preventing illness rather than, well, as well as treating it. I think prevention's kind of been overlooked, certainly the past few years, and we want to build a health system that's focused on prevention, long-term well-being, and also joined-up care, so people can get all the different the support that they need at the right time, and not have to go all the way around the houses. So their first point of contact should be able to direct them to wherever they need to go. We also want to expand the Nature for Health programme. As a Green Party person, I feel like I have to be obliged to say that nature is a great healer, but it can't do everything. So as well as that, we do need to look at a long-term workforce plan to make sure we have enough staff and support workers to help the people that need it. And as well as this, like I said at the beginning, it's very much needs a holistic approach. And so combining that with the preventative outlook to healthcare, we'd also look to improve social conditions that can lead to poor health. So poor, unfit housing, income worries that people have, improving education and access to education, and then also helping prevent discrimination as well that can cause mental health problems. So yeah, we as the Green Party want to very much look holistically at all aspects. Everything is so intertwined in this world now, in this day and age, and so yes, that mental health is no exception to that.